So welcome back to my channel. I know it's been forever since I recorded a video, and I'm so happy to talk to you guys. Here's my update, my pregnancy update. So I'm currently 38 weeks and 2 days today, and I'm super excited. It's almost time, which it's really almost time. So I have a scheduled C-section in just 2 days, and I am super excited. So little Nugget is still breech, so I will be doing a C-section. I tried everything to get him to turn, but he is just so comfortable being so close to mommy's heart, so he want to stay there. So yeah, but I'm definitely excited to meet him on Friday. So I guess I'll just update you a little bit of why I've been gone. I've been super busy preparing for Nugget, but also at 35 weeks I experienced a lot of severe back pain and side and abdominal pain. So I was admitted to the hospital, and I was there for like 7 days, which was kind of, yeah. But yes, I was admitted for 7 days, and then ran tests. I was having contractions. They gave me something to slow down the contractions. They also gave me a shot in case I was gonna have the baby then, help his lungs if he would be delivered at that point. But I ended up being released after 7 days, and yeah, they believe that I might have had a kidney stone. They're not sure. They never found the kidney stone, and yeah, so but I'm doing all better. I was in so much pain. Even leaving the hospital, I was still in pain. They had me take pretty much Tylenol around the clock, which I really didn't want to, because while I was in the hospital, they gave me all like different medications, and yeah, so I really didn't want to come home and take more medicine, but I was in severe pain. So yeah, so and that I wasn't myself until maybe last week. So but I'm feeling so much better, and yeah, so I guess I can talk a little bit about my second trimester, since I did not really discuss that. So in my second trimester, a few symptoms I had was Charlie horses. OMG, I had so many Charlie horses, especially during the night, and in the morning it will literally wake me up out of my sleep. I told my doctor, and she did say that it was normal, and that I can eat like bananas. And one of my friends suggested for me to drink pickle juice. I never tried it, so I don't know if it works, but if anybody tried that and it worked, let me know. Leave it in the comment section. But another symptom that I had was, which I had since my first trimester, was acne. I had severe acne all over my face, which I am still getting a little acne bumps on my face, but it kind of calmed down in my third trimester, so that is good. Also experienced hair shedding in my first trimester, and it got so much better in my second trimester. Actually, I felt like my hair was growing in my second trimester, so that is good. But I continue to do protective styling on my hair, like wearing it in buns. I also had some crochet braids at one point, and I did mini twists in my hair, which I will be doing mini twists in my hair for my C-section. So probably right after this video, I will wash my hair and conditioning and start the process of doing mini twists on my hair. But this wasn't a symptom, but another thing that happened in my second trimester was I had to take the 1 hour glucose test, and I had like a 50 milliliter of the orange flavor glucose, and it wasn't too bad. It tastes like flat orange soda, sweet flat orange soda, and it wasn't too bad. The next day my doctor called me and told me I failed the test. OMG. Yes. So I was very sad about failing the test, but I knew that well, I read that even though you failed the first test, you can pass the second test. So it's pretty common to fail the first test. So I was really sad about it, but I was like, okay, I'm gonna pass this second test. So I had to schedule the second test within a few days. I went to the same place and I took the second test, and yes, they take your blood sugar first, and then you drink the glucose. I think this time it was 100 milliliter of glucose, and then they wait an hour to take it, then 2 hours, and then I believe 3 hours. Next day again, my doctor called me and told me I failed. So yes, I failed the glucose test the second time, and I was really sad. I like literally bust out crying on the phone. I know. I just felt like a failure to my baby, because I was like, OMG, I just want to be healthy for my baby, and I want my baby to be healthy, and now I have gestational diabetes. And she told me that I would have to take my blood sugar 4 times a day. Okay, so I will have to take my blood sugar the first thing when I get up, 2 hours after I ate breakfast, and then 2 hours after lunch, and then 2 hours after dinner. So yeah, so I've been doing that since I think 21 weeks, I believe. So yeah, so that's been a real journey, and it got a lot better after, you know, you get in the routine of taking your blood sugar. So yeah, so that was one of the things that I had to do. So if you don't know, with gestational diabetes, they have different things, complications that can occur, and one of them is having a big baby, and also stillbirth. So ever since I've been diagnosed with gestational diabetes, I had an ultrasound every time I had an appointment. So I mean, I got to see my baby every time with an ultrasound. But yeah, so my sugars were controlled. I did not have to take any insulin because my blood sugar was controlled with diet. So yeah, I was happy about that. My numbers were never high. So yeah, my first appointment after finding out I had a gestational diabetes, I had a ultrasound. He was in the normal range, but he was on the bigger side. So yeah, so as we progress in my third trimester, at my last appointment, my baby was 7.9 or 7.9 pounds at 37 weeks. Actually, yeah, at 37 weeks. At 36 weeks, my baby was 7.9. And yeah, so I had an appointment at 37 weeks, and they did not tell me the size of the baby. The doctor did say that it can be -1 or +1, so it could be 6.9 or around that. So it's not really accurate. So yeah, so she scheduled a C-section. They usually, if you have gestational diabetes, they usually schedule a section or induction 10 days before your due date. So yeah, since Nugget is still breech, I will have to do a C-section. So yeah, and that will be Friday. I will 38 weeks and 2 days, and I will have him at 38 and 4 days. So that is the update, my pregnancy update, and I'm just looking forward to, well, Christian and I is looking forward to meet Nugget. I wanted Christian to be here to do this update with me, but of course I'm here at home and he's at work. So yeah, and we pretty much almost done with his room. I just have a few little minor things that I would like to do to his room, but mostly he will be in our room until I guess maybe 3 months, or until I feel safe to have him in his own room. But yes, that is my pregnancy update. I hope you guys enjoy this video, and please leave me any tips, because I am a first-time mother. And yes, please leave me any tips and advice, and keep me in your prayers. Please keep me in your prayers, because I will be having a C-section, and it is a major surgery. So yes, please keep me and my family, my baby, in your prayers. And yeah, I will try to vlog a little bit. I'm not sure how that works with C-section, and yeah, but I will try to vlog a little bit of my experience and everything. Yeah, I just hope everything goes well, and I'm just super excited to see my baby. I waited this long. So yeah, I know I'm probably gonna be in pain, but it's gonna be all worth it for Nugget. So, and we did decide on a name. So yeah. So I will let y'all guys know his name later in a different video. Okay, but I wanted to show you my baby bump at 38 weeks and 2 days. So here's my baby. So this is the front here, and Nugget's head is like right here. But this is the front, and then the side here, and then the other side. So yeah, that's my baby bump. If you enjoyed this video, please like, subscribe, and comment below. So I'll talk to y'all guys later. Bye. Elasticity. It forms a protective layer on the skin surface, preventing moisture loss.